So by now we have finished the inguinal ligament. Then we'll start with the inguinal canal. Now you just note the thing which is in blue color. So this is called as deep inguinal ring, and this is called as the superficial inguinal ring. The inguinal ring is oval in shape and it is the opening in fascia transversalis. The deep superficial inguinal ring is triangular in its shape. The part which is colored in red is called as superficial inguinal ring. It is the gap in external oblique aponeurosis. It is shaped like an obtuse angle triangle. The base of triangle is formed by pubic crust. The two sides of triangle form the lateral and medial margins of the opening. Now you carefully observe this with dotted lines. So this connection between or oblique passage in the lower part of anterior abdominal wall in between superficial inguinal ring to deep inguinal ring is called as inguinal canal. It is about 4 centimeters in its length. 4 centimeters in its length. The margins are referred to as crura in case of superficial inguinal ring. At and beyond the apex of triangle, the two crura are united by intercrural fibers. So this is about the superficial inguinal ring and deep inguinal ring. We will revise again. I'll show you the superficial inguinal ring first, which is triangular in its shape, and this is the deep inguinal ring that is oval in shape. Now if you join these two, so that will be the inguinal canal, that is about 4 centimeters in its length, present on the lower part of the abdomen. So this is about the inguinal canal with its two openings, superficial and deep inguinal ring. Now we'll go to next part, that is what are the relations of the and the inguinal ring. So this is what we already showed you, or the inguinal ligament that is already over. Now we'll come to this inguinal canal. It is a weak site on anterior abdominal wall. Now we'll see what are the peculiarities. It is narrow in case of females and straight, and it is forward in case of newborns. That is the major thing. We'll go to the boundaries of inguinal canal. It has the anterior wall, posterior wall, roof and floor, inlet and an outlet. Inlet and outlet we have already finished. That is, inlet is formed by deep inguinal ring, oval in shape. Outlet is by superficial inguinal ring, that is triangular in shape. We'll go to the inlet, that is deep inguinal ring. It is oval deficiency in fascia transversalis. It is about 1.25 centimeters above mid inguinal point. 1.25 centimeters above mid inguinal point. If you carefully observe, this is the deep inguinal ring that you are seeing. Deep inguinal ring. We will go and see what is the superficial inguinal ring. So in this diagram you can see it is a schematic diagram showing the deep inguinal ring, that is opening in fascia transversalis muscle, and this triangular shape is the opening in external oblique aponeurosis, and these two forms the inguinal ligament. We'll see the outlet or the superficial inguinal ring. If you carefully observe this diagram, so this is the superficial inguinal ring. It is a triangular gap in external oblique aponeurosis. It has apex, base and two cruras. Now we'll go to the anterior wall of inguinal canal or boundaries. That is, it is formed by the skin, superficial fascia and external oblique aponeurosis. Only the lateral one third it is formed by fleshy fibers of internal oblique aponeurosis. These are the structures which form anterior wall of inguinal canal. Number 1, skin, superficial fascia, external oblique aponeurosis. Only in the lateral half or one third it is formed by fleshy fibers of internal oblique muscles. External oblique, internal oblique, all these are muscles of anterior abdominal wall. Next we'll go to posterior wall. It is formed by fascia transversalis. You can see in the purple color, this full part is the fascia transversalis. Also it is formed by extraperitoneal tissue and parietal peritoneum. In the medial two-thirds it is formed by conjoint tendon and also by reflected part of inguinal ligament. So these are the boundaries of posterior wall of inguinal canal. Now we'll go to the roof of inguinal canal. It is formed by the arched fibers of internal oblique and transverse abdominis muscle with ilioinguinal nerve. The roof is formed by arched fibers of internal oblique and transverse abdominis muscle. Floor is formed by grooved upper surface of inguinal ligament and at the medial end by lacunar ligament. The inguinal canal is larger in males when compared to females. Now we'll come to structures that are passing through the canal or contents of inguinal canal. Number 1, spermatic cord in case of male and ilioinguinal nerve. In case of females, it is around ligament of uterus and ilioinguinal nerve. Now we'll see what are the constituents of spermatic cord. It has duct friends. It has ductus, the testicular artery, cremasteric artery, campaniform plexus of veins, lymph vessels from testis, and genital branch of genitofemoral nerve. So these are the contents of spermatic cord. Now we'll see what are the coverings of spermatic cord. So it is made up of 3 layers: the internal spermatic fascia, the cremasteric fascia, and external spermatic fascia. These are the coverings of spermatic cord. And now we'll go to protection or mechanism of inguinal canal. Number 1, the presence of inguinal canal causes weakness in lower part of the abdomen. Therefore, when intra-abdominal pressure is increased, the anterior and posterior walls of the canal are approximated, thus obliterating the passage. This mechanism is called as flap valve mechanism. That is, two things: operating of inguinal canal and also due to compression of inguinal canal posteriorly. That is the mechanism called as flap valve mechanism. Next is the superficial ring is guarded from behind by conjoint tendon. Third one, arched fibers of internal oblique and transversus abdominis muscle. It acts as a sphincter. Then cremasteric plug, it acts as a ball valve mechanism and also due to contraction of abdominal muscles. So all these things protect the inguinal canal or mechanism of inguinal canal and prevent contents of abdomen to enter into the exterior or to the inguinal canal. Now we'll come to some clinical importance. The most important clinical aspect for inguinal canal is hernia. We'll see what is definition of hernia. Abnormal protrusion of abdominal contents, that is greater omentum and intestine into the inguinal canal, is known as inguinal hernia. Abnormal protrusion of abdominal contents. So what are the abdominal contents that come out? Number one, greater omentum and intestine. It is called as inguinal hernia. This usually occurs in persons in whom intra-abdominal pressure is frequently increased. That is, in case of people with chronic cough or people who work involving frequent lifting of heavy objects. So hernia is common in people with number one, chronic cough, and number two, frequent lifting of heavy objects or heavy weights, etc. Now we'll see what are the types of inguinal hernia. There are two varieties mainly. Number one, it is called as direct inguinal hernia and indirect inguinal hernia. When the contents of hernia enter the inguinal canal by passing through deep inguinal ring, it is called as indirect inguinal hernia. When the contents of hernia enters the inguinal canal through the posterior wall, the hernia is said to be direct hernia. Again, there are two different types of direct hernia. Direct hernia passing through Hessel's-Back's triangle is medially bounded by rectus abdominis, medially by lateral border of rectus abdominis, laterally by inferior epigastric artery and inguinal ligament. This triangle is divided into medial and lateral parts by obliterated umbilical artery. Usually direct hernia occurs in old age. Usually the patient will come with swelling in the groin which increases on coughing. Direct inguinal hernia. There are two types, that is medial and the lateral type. Mainly occurs due to bilateral cause due to old age. Now we will see what are the coverings of direct hernia. Coverings are number one, again there are two types, medial and lateral direct hernia. The lateral direct hernia is same as medial, will go with the medial coverings of medial direct hernia. Number one, extraperitoneal tissue. Number two, fascia transversalis, conjoint tendon, then external spermatic fascia, and the last one is the skin. This is medial direct hernia. If you carefully see this, fascia transverse extraperitoneal tissue, the internal spermatic fascia, and the fascia transversalis. So these are the contents of or coverings of direct hernia. One is the lateral and this is medial. Now we'll see what are the direct inguinal hernia. It occurs entry of triangle through triangle of Essel's back. There are two types. I already told you, mentioned you, medial and lateral. Coverings of direct hernia. These are the coverings of direct hernia. And this is coverings of indirect hernia. You'll see what are the coverings of indirect hernia. Number one, it is the internal spermatic fascia, extraperitoneal tissue, cremasteric fascia, external spermatic fascia, and also the skin. These are coverings of indirect inguinal hernia. Indirect inguinal hernia. Clear? Fine. So this finishes what are the types of hernia and what are the different types of hernia. There are two types, direct and indirect. In direct type, again two types, the medial and lateral part. Indirect type, there are types in indirect inguinal hernia: congenital funicular, bubonocele, and acquired hernia. So this finishes inguinal canal and its applied anatomy. To summarize the class, we started with the inguinal canal. What is the extent, what is the length of inguinal canal, then what is the boundaries. It has got anterior wall, posterior wall, roof, and a floor, inlet and outlet. Length is about 4 centimeters. So this was the hernia. Then later we studied about the coverings or the contents of inguinal canal. The contents were round the spermatic cord in males, round ligament in females, and also ilioinguinal nerve. Next we studied about the coverings of spermatic cord. It was having three coverings: internal spermatic fascia, cremasteric fascia, external spermatic fascia. Then we studied about mechanism of inguinal canal. Then we studied applied anatomy, that is inguinal hernia, direct and indirect types. I hope you have understood everything. If you have any doubts, you can send me the email. Thank you, one and all.